It's what we all suspected from anecdotal evidence. The flu bug this year has been rather a nasty one. Now we have the statistics. Between November and January, flu has been diagnosed 328 times, compared to 221 for the corresponding period last year. 102 of these were at A&E. Again, this represents a huge increase from 58 cases last year. Overall, 500 cases came to A&E between the 22nd and the 29th of December. This means doctors and nurses have been extremely busy. But the Health Minister Neil Costa says forward planning has allowed the department to keep 32 beds available at all times.
A&E is equipped and staffed to be able to deal with that surge. I mean, we have been planning for the winter surge during the course of the year. One of the things that we did, apart from making sure that we had resilience at A&E, although we did not expect that we would have certainly 500 people attending during the dates that I have mentioned, but we did resource it properly. You may recall that we now have an additional staff nurse per every shift. We've recruited an A&E consultant who's currently in fact reviewing the entirety of A&E, and we also have the additional bays. So we were ready for the winter surge. Our concern principally was in fact due to the potential number of admissions into hospital and making sure that there was bed resiliency. But as I said, thankfully, due to the incredible work of the bed management team, the clinical nurse managers, the medics, all the GHA team, we have had, even during those days, an average of bed availability of 32 beds.
Earlier this year, the GHA announced it would be employing an extra GP at the primary care centre during the winter months. Another measure at the PCC, a walk-in clinic, has generated an average of 18 unused appointments every day. The GHA assures no patient turning up at A&E will be turned away untreated. But all cases will be dealt with according to their urgency.